Yes, it is. Thank you for having me here. I think one of the unusual situation now compared to the first wave, we're seeing now much more children being infected by the virus. This Delta variant has currently affected children. 12% of the positive cases are actually children, and mostly in the range of 7 to 12 years old. But we're also seeing a range from between 0 to 18 years old. So this is a very concerning thing. And out of that, 12.6%, 3% ended up in death, with 50% of the death children below 3 years old. So that's a real concern, obviously.
Why do you think Indonesia is seeing this trend among young people where COVID is concerned?
We don't have the analysis yet, but I think in our own view is that the Delta variant had entered Indonesia in March, and at that time, children were still in school or at home, learning from home. Shortly after that, there was the long holiday because of the Muslim celebration, and people were moving among regions with families to celebrate. So they went back to their hometowns. So by that time, that transmission had really spread around, including with children. So there's some analysis that this Delta variant children are much more susceptible now to this Delta variant, but also children are were much more out there during that holidays. So I think that is a combination of those two, the variant as well as the movement of the families, including their children.
And of course, Bonaria, for many Indonesians who live with their extended family under one roof, it's particularly hard to isolate. So we're seeing entire families being infected.
Exactly. And I think this is one of the concern as CARE. We are concerned about the women and the children because 50% of the positive cases also are women. And usually women are the caregivers in societies like ours. So this obviously is a concern when an entire family, including the primary caregiver, is affected. And it's very hard now because unless you have moderate and heavy symptoms, because of the overwhelming capacity in hospitals, people with very mild symptoms or no symptoms at all are told to isolate at home, to the extent that the government can actually accommodate in hospitals. They will take them on. But otherwise, they're told to isolate at home. And this is very difficult for families that usually don't have the facility or the luxury of separate rooms, separate bathrooms. So you can imagine this is one concern if families or several members of the families are infected.
Can imagine.
And that's why we're focusing,
Yes.
That's why we're focusing our support to those families as well.
And also with businesses closed and these restrictions that you talk about, how are families coping financially? Are they getting help from the government, sufficient help?
Yes. That is another concern. I think the economic stress, particularly for middle lower income, because either they might lose their jobs, as in the case of last year, or people being furloughed and reduced working hours. So the stress is really high. And some cannot afford also to stay and work from home. This is particularly the informal sector. So the government, we are now under some kind of partial, we don't call it lockdown, but emergency restricted movement, focused in Java and Bali, because this is where the crisis is really at the moment, even though the outer islands are also seeing a rising trend now. But during this period, until the 20th of July, there is very restricted movement, and people are told to work from home, except for the essential and critical sector. And along with that, the government has also launched a package of social and cash assistance for families that are the low-income families and those that are in the informal sector. But obviously, there's always, it may not be sufficient. So some people are still trying to make their living despite the restrictions. And this is a situation that you cannot avoid.
And it's so hard to know the true figure of COVID in Indonesia because testing rates are among the lowest in the world. Why is that? Why is the government struggling to have more people tested?
Well, first of all, I think there less people are inclined to go for testing. But now with this, during this emergency situation, the government has ramped up the testing and tracing. And the tracing is also a struggle because the resources to do the tracing is also quite stretched. So this is one of the challenge. So even if you've tested, to trace the contacts is also not as easy because there aren't enough resources. So in one of the meetings with the coordinating ministry, for example, there have been some kind of appeal to the civil society organizations for perhaps to help them. In fact, only this morning, we were just talking in one of the districts where they were actually working with volunteers now to do the tracing. So that is a challenge, obviously. So you're only probably seeing an iceberg, as some people say, of what the numbers actually represent right now. So I think that is the challenge under the testing and tracing. But that's been ramped up in the last 2 weeks.
And Bonaria, you've been on the road visiting the health clinics. Describe for us what you've been seeing.
Well, yes, we saw 2 clinics, but unfortunately, because these are the 2 clinics that receive the highest numbers of patients. And because we were not properly attired for, we were not wearing PPEs, we were not allowed to go in. But we saw some people queuing up, but we cannot see the inside. This is one of the districts that is now considered as orange zone, but this is a district that also receives patients from other districts nearby. And so they've been working with the hospitals because they cannot actually take on more patients. Now health centers, which are usually based at the sub-district level, have been asked to take on patients until they can be accommodated in hospitals. But that means that they also have to provide treatment, which are not all health centers equipped for. So I think that is the situation right now. And most health centers are, manned by 1 or 2, 3 doctors, and then the rest are nurses. And they can only accommodate 10 to 20 people at max. So that's also going to be something that we have to watch out for in case the cases spike even further as we move towards the peak.
Yes,
how
I
this
understand.
is going to be actually. Yes.
I understand.
Yes.
If we're
yes.
yet to reach the peak in Indonesia, we will be watching from here very closely. Bonaria Siahaan, great to talk. Thank you for your insights.
Thank you for having me.